the blue and the green rather than the red, which will add its weight. One thing, no, all the professors are talking about all the modalities. All of them are using only one, that is laser. Okay? What we are going to do now is 30 valuable minutes, most valuable of our life, to share our experiences and the evidence and what is all this about. So laser therapy. Okay. Low-level laser therapy, its application in evidence-based electrotherapy. Don't bother who I am. Why a manual therapist is speaking about laser. Okay? Manual therapy does not mean that we contraindicate all the electrical modalities. You should know which modality to apply with what is called as clinical reasoning. Okay? And laser therapy is also given referring to the manual only. We will keep referring to the manual of the company, where different companies give different descriptions. So both are always related. My grateful thanks to Dr. Abhumaya, HOD, Associate Dean, Bengal, Manipal, and our HOD, Dr. Sailakshmi Ganeshan, Associate Professor and HOD, KMC Mangalore. Coming to the content, we will see definition. Definitely all of you will know. Terminology. Terminology has been different all around the world because of the different settings, different groups of medical professionals which use this. Types, classification, properties, principles, physics, component of the laser, biophysical effects, and the clinical applications. The last one, most important part, is the evidence-based recommendations. I actually used to take only 30 minutes. Okay, I'll never exceed a minute also. You can stop me if I am under 30th minute. Okay, at the end of the 30th minute. Okay, I give you all freedom. Okay, start. Okay. Definition. Laser is an acronym for? Yes. It's also defined as the base thermal, that is non-thermal therapeutic application of low output, that is less than 500 milliwatt lasers, which is monochromatic superluminous diodes for the treatment of disease and injury at a dosage less than 35 joules per centimeter square, too low to affect any detectable heating of the irradiated tissues. Don't worry about the length of the definition, and don't also worry about the term low level. It does not mean laser is anywhere low to any other modality. Terminology. Therapeutic laser, low level laser therapy, low power laser therapy, low level laser, low power laser, all these terms. I'm not going to read all of them. Biostimulating, bioregulating, photobiomodulation laser, all these terms. Cold laser is another term because it is non-thermal. Types of lasers. We have, depending on the material that is used, crystalline glass into solid state materials. Example, synthetic ruby. Gas, we can use the noble gases, that is helium, neon, argon, carbon dioxide and others. We can also use what is called a semiconductor or the PN junctions, the diode laser, which is the common one, the reason for gallium, aluminum, arsenide lasers. Liquid dye lasers are also there, but they are still under investigation, they are not yet fully developed and applied. Chemical lasers were the first to be introduced, most commonly applied in the laser in the army and in the war for the military purposes. Types of lasers. You have ruby, helium, neon, gallium, aluminum, arsenide, diodes and the carbon dioxide arranged in the terms of the wavelength. You can see that the initial ones are red light, which is visible, infrared is falling in the invisible range. Classification of lasers is also given depending on class 1 to 4, class 1, 2, 3A, 3B and 4, depending on the possible effects and risks of hazard. Okay. Class 1, which is what I am using in the left hand here. Okay, the point is, class 2, 3A and B could be used for therapeutic models, which is in our profession physical therapy. Class 4 is used in the surgical models, mostly for cancer and for private surgery. Properties of laser, 3 properties. What is it? Coordination, monochromaticity, power. Excellent. Monochromaticity is the one color. Okay, of the wave. Principles of laser dates back to Albert Einstein, who proposed about the quantum theory for the photons, where it is called as the energy packet for the transfer of light. Laser also follows all the principles of the electromagnetic radiation, like law of reflection, refraction, Coulomb's inverse square law, Poisson law, and the Gross's law. What is the physics? When you have a material which is heated or is supplying electrical energy, what happens is the material glows. The glowing of the material is termed as fluorescence. It glows, actually the electrons in the atoms, they actually get energized and they go to a higher orbit. They might go, but when they come back, again they fall to the lower orbit and they emit as light. That is the fluorescence. But if you increase the energy level to a level where the electron gets totally energized and when it jumps, it emits what is called as a photon. For emitting a particular level of photon, each atom and each material have different coefficients of energy input. Okay? After that, one photon is emitted. What it does is, it goes and it hits another atom, and then again what happens is the other atom also gets energized and another photon is created. Okay, what is called as stimulated emission. That means one emission of photon stimulates another emission. The stimulated emission. Once you have stimulated emission, you have now many number of photons. So all of them are together, what is called as the avalanche effect. And then what happens? Finally, the material has more atoms in the unstable state, what is called as the metastable state. After what is called the process of population inversion. That means greater atoms are there which are not in their stable energy levels than the stable atoms. So spontaneous emission is the first one. Next one is the absorption of the radiation by the high level atoms, and then stimulated emission. Essential components, these are the basic components in all the laser devices. First, what we have is the power supply. The electrical power supply that can deliver up to the 10,000 volts and hundreds of amperes. Lasing medium, which can be either gas, solid or liquid. These are in the types of the lasers. Pumping device, that is for producing the energy to the medium. That is the high voltage photoflash lamps. Usually it's a light source, radio frequency oscillators or other lasers. Pumping is used to describe the process of elevating and orbiting electron to a higher excited energy level. Optical resonance cavity, because we need to have what is called the focused application of the waves. Okay, so we have what is the resonance cavity which contains the lasing medium. Complex type. I am not going to talk about the ruby laser, which is the traditional one which is outdated. Okay. Helium neon laser, it uses a gas mixture of helium and neon in a pressurized tube. Creates a laser in the red portion of the electromagnetic spectrum. The wavelength is 632.8, which is already mentioned in the table. Power output can vary 1 to 10 milliwatts. The higher the output lasers, they allow reduced delivery time. Penetration, you will have 15 millimeter depth of monochromatic and coherent radiation, but the penetration goes beyond that. It can go to 6 centimeters also. Gallium arsenide laser, it utilizes the diode to produce infrared. Helium neon is actually falling in the more towards the visible, whereas gallium arsenide falls in the invisible lasers. So 904 to 910 nanometer wavelength. It's composed of semiconductor, silicon materials, precisely cut and layered. Electrical source applied, it creates a potential. With that potential difference between the positive to the negative, the electrons will travel. It will travel only one direction. Okay. Delivered in a pulse mode because of the heat produced at the junction. Energy depth can also occur similar to the helium neon laser, that is the 2 centimeters penetration. Beyond that also penetration happens, but it is with the catching and more of absorption. Okay. Power output may produce up to 2 milliwatts. Physiological effects. We have seen all these modalities. We have seen all the physiological effects. Remember, some have direct systemic effects. Some have mechanical effects. Cellular level, tissue level maybe ultrasound can come, and towards for Dr. Canada, who presented on ultrasound, tissue level it can come. Cell level it can go, ultrasound can reach it. But nuclear level, we want to see at the DNA level and the RNA level, only one modality which can reach is the laser. Okay, it changes goes for immediately. It is useful for the cancer tissues also. Okay. Trial surgery and the laser surgery. Wound healing and then pain relief. Biophysical effects, one is the influence, what causes this, and then on the tissues, we can produce wound healing and also the pain relief. What is this tissue and the so-called cellular response because of the laser? One is, before knowing what is the response, we should know what determines the tissue's response. One is the output, obviously. What comes from the laser will determine what the laser will achieve from the tissue. And the next one is density of the power, duration of the treatment, and the most important, vascularity of the target tissues. It should be fully vascular, then only you can have better cellular response. We have two types of effects called as the direct effect and the indirect effect. Direct effects occur from the direct absorption of the photons by the cells and by the nucleus. Indirect effect comes from the chemical events. Once the photons are observed, the tissues will go for a chemical changes. Okay, that is what is called as the indirect effect. What are these effects? First, red light. When you have red light, you know this pointer has how much effect on your own eye. We will not get alert as long as you focus on this pointer. Okay. If you focus on the letters or on the slide, you will feel tired. Okay. Absorbed. First, the red light is absorbed by the mitochondria and the cytochromes. Cytochromes are the pigments, which actually are light sensitive and the photosensitive pigments. Respiratory chain enzymes are there within the mitochondria where they absorb and they initiate what is called as a reaction for the biological response from the light. Infrared light is actually absorbed by the proteins in the cell membrane itself, whereas the red light is absorbed within the cell. That is the mitochondria and the respiratory chain enzymes. Infrared is at the level of the cellular membrane and the permeability is influenced. What is the cell? We have a nucleus here. We have the chromatophores, which are the chromatin, that is the pigments, at the level. Mitochondria are all very familiar. Continuing with the tissue responses, what happens is respiratory chain enzymes, they function to couple the release of energy from the metabolites, and what they do is they form and they help in the ATP production. ATP are the energy reserves of the cells. So once energy is there, it will be used to drive the cell metabolism to maintain the membrane potential for proper tissue transfer and also for synthesizing the proteins which are immune response. Okay, any kind of protein is going to be for antibodies. And the power itself is also motility of the cells, that is the transfer across the cell membrane, and also for replication, that is the multiplication of cells, which is most important for tissue healing. Assuming that cytochromes can also absorb energy directly from illumination, it is possible that because of the synthesis of ATP, laser influences the cell metabolism. What are the principles of clinical application? We will be seeing under indications, dosage, treatment, other treatment what we can give other kinds of wounds, hazard, contraindications, safety considerations and precautions. This will take less than 5 minutes. Don't worry about it. Okay. Indications for wound healing, any kind of soft tissue healing, any soft tissue, acute or chronic, don't worry about it. Laser is always there. Pain relief with also what is called as laser acupuncture. Intra-articular healing, especially if you find with an arthroscopy, we are missing orthopedic surgeon here, but definitely articular injury is good body if you want it to be healed. That is there. Okay, it will there is there. If you have to tell, intra-articular healing also it helps. Precautions, remember, it's always better to underexpose than overexpose the part. Okay, overexposure is one which is common. Because therapists seem to be getting over-motivated, seeing the results in first treatment itself. Okay. And the other one is open, infected and discharging wounds. Make sure that you clean them properly and use the correct method. And when you are using it over the sympathetic ganglia of the vagus nerve or the chest in cardiac patients, make sure that it will affect the metabolism of the ganglia. Remember, autonomic nervous system if it disturbs, all your vital functions are going to get disturbed. Photosensitive areas, treatment, then the laser will be directed. It will become difficult for the therapist. Alternate skin sensation, even laser do not cause any skin reaction, but still it's a precaution. Okay, when there is alternate skin sensation, especially if there is a hyperalgesia, like if there is an abnormal perception of many sensations. Dosage, how do you calculate the dosage? It is usually reported as energy density, that is joules per square centimeter. Okay, joules is the word for the energy. So 1 joule is actually 1 watt per second. Dosage is dependent upon again output of the laser, time of exposure in seconds, and the beam surface area of the laser. We have the 4 parameters to calculate. Power output is usually given in the milliwatt by standard companies on every type of laser probe. And we calculate next what is called as power density. That is how much power is applied per centimeter square of the head, treatment head. And then the next one, energy, you calculate by the power output multiplied by the exposure time. How much dosage is to be given. That is the total energy that is given. Energy density is again energy divided by the spot size of the head or the square centimeter of the head. Pulse repetition rate is defined in terms of the frequency, that is the hertz. We have one more type of application of the wave called as the continuous wave. In some way you see CW. Okay, it is the continuous wave form. Treatment technique, they are very simple to use. It's for general application, only treatment time and the pulse rate vary. You just have to adjust this. Dosage is the most important variable in the laser therapy and may be difficult to estimate because of the above conditions. Okay, because we vary also the treatment and also the pulse rate. Treatment time also is variable, pulse rate is also variable. Okay. Very simple handheld applicator, very light. The tip should be in light contact with the skin. Prefer to use the contact method more than the non-contact, except for open wounds. And even for the wounds also, when you are giving in the periphery, you can always use the contact methods. Okay. Treatment for the wound edge, use the contact technique. 1 to 2 centimeter from the wound. Okay, from the center of the wound, go 1 centimeter, and the point of application, each point of application when you apply the periphery, it should be 2 to 3 centimeters apart, and it should be 1 joule per point. Okay, at one point you should give only 1 joule, or when you are choosing totally, do not choose more than 10 points of application outside the ulcer or the wound. Wound bed, you can use the non-contact technique. 4 joules per centimeter square, because they are giving increased energy density here, because infection will be there. They expect that the antibiotic effect of the laser should act. Okay, that is the inhibitory effect. Before that, what you should do is you can also map the wound by means of an acetate or a plastic paper to graph it, to measure and record the size of the wound. We have some techniques called as spot treatments. We have different spots we can keep. Okay. We can also use what is called as splitting. That means we can go right to left and then we can go top to bottom. Okay, like a imaginary grid. Scanning treatment is you go zigzag. Okay, we go like this. Scan. Then like most of us will be giving in a circular fashion, we will be scanning in the terms of ultrasound when you are applying. Okay. Cluster array treatment is to take a cluster probe, which is a combination or it's a mixture of both different types of diode probes. Okay, it's a cluster of probes. We can keep at different points. Maximum try to cover the area of the wound. Other laser treatments we can use for superficial bruises and the hematoma. Trigger points we can use, nerve roots and the trunks we can use, soft tissue injuries we can use. Neuropathic pain, recently studies have shown that it's highly effective also because it causes the regeneration of the nerves also. Okay. Arthrogenic pain. We have one we could get from the sponsor company BTS. There is a system which looks highly attractive, extremely consumer friendly. Okay, you just start using the machine. Anyone is an expert in using lasers. Okay. It gives all the directions. Contraindications, carcinoma, because of the risk of spread, hemorrhage, because of the excessive loss of blood. Cognitively impaired patients, because you won't get any kind of cooperation from them. First trimester of pregnancy in the pelvic region, when you apply lasers, be careful. So better to contraindicate because risks have not been yet documented, but still to assume that it is contraindicated. It is better to assume contraindicated than to ignore and cause harm. Hazard. We know that the hazard is most possible for the on the visualizing the path during the treatment. Merits of lasers. What are the so-called merits? One is relief acute or chronic pain, increases the speed, the quality and the tensile strength of the tissue repair, faster tissue healing because it is at nuclear level, increases the blood supply, general effect, stimulates the immune system. All of us are so fond of what we are doing, physiotherapy, what is the effect on the immune system. Nowadays, studies have been proven in HIV patients also, exercise therapy is effective. Okay? Aerobic exercise is effective. Okay? So we address the immune system, stimulate the nerve function, nerve metabolism, develops the collagen and the muscle tissues, helps generate new and healthy cells and tissues, promotes faster wound healing or clot formation, reduces inflammation. Most important, when you sit with an ultrasound, you sit with for at least 5 to 10 minutes. The camera will do some other calculations, I'm not sure. Okay? Remember, if anyone asks you to give ultrasound, you will always think twice whether I am free or not. Will any other patient will come in between? Okay? That's the question will come. For later, duration is very less. You just give 30 seconds, give 20 seconds, different dosages. You can also give 1 minute. Maximum duration at one spot is only 1 minute. If you use a cluster probe, you will save a lot of time. It will be a larger area. Okay? Remember that time required is very less. In this fast moving world, we need something which is fast. Fast to give treatment, fast to give relief also. Okay? Demerits. Will there be any demerits? Different manufacturers, we don't know what to do with this. Okay? Different companies are there, they keep recommending differently. We don't have even if all of them are ISO candidates, still we don't know which one is actually what. Okay? And they explain the laser probes with different parameters. Okay, with either the milliwatt or the wavelength. Different treatment parameters, as I told you before, it's not like a set protocol or set parameters for this pathology. 10 means this much you give, J1 means this much you give. It's not like that. It's only that the parameters can be changed depending on the response. Possible are that if in case anyone was curious enough to look into the laser beam. Okay? What happens to the evidence? We keep applying laser here everywhere, temporal joint, anterior knee pain, osteoarthritis, Achilles tendinitis, all this, for rheumatoid arthritis. Before going to the evidence, what I would like to tell you is briefly on what is this evidence first. Okay? We have what is called as the evidence pyramid. We have come to the last 10 minutes actually. Okay? Evidence pyramid. Remember, the top of the pyramid, we have one in the right side, that's the meta-analysis. That means you club all the results of all the studies, of different study designs, you can still get the effect size. You can get what is called as how much effect the treatment or the intervention has. Okay, it is done with the software, we just have to apply all the details. And we know that randomized control trials, these are studies which are like you don't know where the patient is going into, whether a control group or the experimental group. Without bias, you allot them by either a lot or anything. Double blinded, tester and the patient are not aware that the research is going on. Okay, you might take a consent, but it's only for treatment, not for the purpose of research. Okay. Cohort studies is the next. Now, the cohort means we are studying one type of population, like in athletes, they are cohorts. Okay. Geriatrics, another cohort. Children, another cohort. Case control, you have normal subjects and you have disease subjects. Case versus controls. What is the response to the normal population versus response to the affected population? Case series is a group of subjects, like 10 patients with supraspinal tendinitis or speakers. That is case series. Case report is single case series. That is, you just found one fine case with a combination of all the pathologies you have treatment dramatically with laser and you can just publish. That is the case report. After that, editors of the journals will write new opinions. Okay, they are written next. Next one comes the animal research, and the last one comes the test tube or the laboratory in vitro research. The levels of evidence, we have level 1, 2, 3, 4, 5, but we have subcategories of the 1. Level 1 is actually subdivided into A and B. Each sublevel we have A and B. A is the systematic review of the RCTs and the meta-analysis. B is the individual randomized control trials. Okay. If I say 1A, it is 1B means individual RCTs. Similarly, 2A means systematic review of the cohort studies. 2B is individual cohort studies. 3A is systematic review of the case control studies. These are next in the pyramid. Okay? And the 3B is the case control studies. Level 4 is the case series. 4A, 4B is the case reports. 5 is editorial and expert opinion. 5B is the laboratory and the animal research. Remember, laboratory research is never considered applied to clinical practice because of the controlled conditions of environment which is there. Also useful. Lasers proven to be effective in the pig specimen or the rat specimen is not going to directly apply to our tissue specimens. It's very difficult. So always clinical trials are highly rated. Okay, in that also we have what is called as randomized control trials, highly rated, taken from the Cochrane collaboration. We have different types of study designs. All the study designs, descriptive studies, analytical studies. Descriptive comes for case reports, case series, and descriptive studies. Analytical studies can be interventional or observational studies. Observational may be assessments. Okay? Interventional one can be randomized or non-randomized. Okay, any of these possibilities. Observational ones are controlled into case control cohort. Cohort can be prospective if you do in the present time into the future. Retrospective if it is present time into backwards, okay, into the past. And then cross-sectional studies, which is just one-time measurements, and we also have other type of study design. Level 1A studies, what do they say for laser? Venous leg ulcers. Okay, for wound healing, it's a Cochrane systematic review, no evidence. Don't be disappointed. Cochrane always says no evidence because the Cochrane group is a very rigorous analysis of the literature. Okay, they have highly systematically organized protocol and it's world over it's analyzed for all the vigorous quality of the study. So most of its conclusion will be inconclusive or no evidence. Okay, don't be bothered about it. Sometimes they say weak evidence also. Plantar heel pain, for again no evidence. For Achilles tendinitis, weak evidence. This is again from the Cochrane systematic reviews. Wound repair, we have one called the meta-analysis that is rated higher than systematic reviews, and you will know that it is effective tool for promoting the wound repair, any kind of wounds. In tissue repair has also been controlled with the general soft tissue injuries. All the soft tissue injuries, they have clubbed all the literature and they have done a meta-analysis, and they showed that again effective, highly effective therapeutic armamentarium. In the treatment of osteoarthritis, again Cochrane, we can expect that it's a conflicting evidence. Some studies say effective and not effective. Rheumatoid arthritis, again we have effectiveness only for the short-term treatment. In the management of neck pain, we have systematic review which gives limited evidence. But remember, all these reviews conclude only one thing, that we need more high-quality studies. Okay, the most important problem which was noted in all these reviews and the evidence which was noted was the individual studies are lacking in their quality. Okay. So there was always scope for further research. Level 1B, individual randomized control trial. Effectiveness for musculoskeletal back pain improves, moderate reduction in the pain. Shoulder pain, they have better results with respect to the palpation sensitivity, but not in terms of the range. For that electrical analysis, there was a question today. Remember, it was a safe modality, the conclusion, but it was ineffective. So you are all right if you are not chosen later, don't worry. Future research will tell. For the male electrical analysis, when it was combined with what is called as a multi-center, that means different institutions, different areas, double-blind placebo control, because we have all this effect of placebo. Dr. Vasantham was telling about placebo. We should always be what is called as one treatment you give, saying that this treatment will be the best and it will be very effective to tell the patient directly. The other one you give this laser. So you are actually comparing between a treatment which has no effect, but you tell the patient that it will be highly effective to get the effect of the placebo. Placebo controlled trials are very important actually, because in any kind of electrical modalities, you need to do what is called as placebo controlled trials. Also, another one what is called as it says about the efficacy of the low-level laser therapy in the epicondylitis. Carpal tunnel syndrome, again we have effectiveness for the laser. These are individual randomized control trials. Remember, ankle strain, nothing was effective. Okay, high or low dose laser therapy was effective. Until tendinitis, and they measured the prostaglandin concentration in the peritendinous area. For example, histological confirmation show that it is healing, and they found that it can reduce the inflammation. In fibromyalgia, there is a similar condition. You know how difficult it is to manage. You give combination of ultrasound and IFT, which was recommended in the morning. They give multiple trigger points, but still to affect the connective tissue and the healing of the muscles and the fibers, it's always better that you give laser and amitriptyline together. Okay, that means drug interactions are less with laser because it's at the nuclear level, it is not in the hematological. If the effects are at hematological, drug also will interact with the modality. Okay. Raynaud's phenomenon, another common presentation will be often confused with the complex regional pain syndromes. It is actually a peripheral vascular disease, arterial. And here again, what they found was it reduces the frequency and the severity of the Raynaud's attacks. Okay. Remember, they recommended that it's less effective in patients with delayed hyperemia. That means if vascular problem is there, so vascularization is delayed. Okay, such a delayed vascular response if it is present, then it may be less effective. 4A are the case studies, case series. Only one case series was identified. They used the trigger point technique for the pain area, and they concluded that laser could be given either as a monotherapy or as a supplementary treatment. Don't worry about the dosage in each of these studies, because remember the references will give the dosages. Greatly thankful to all these authors, which are standard or prescribed textbooks. Which minute I am in now? 25th? 30. Okay. The last part of this link are not in your CD. This is Kumar.com, thecopenlibrary.com, pedro.fhs.edu.edu, your patent at the University of Sydney, Education, Australia. clinicalevidence.com, you just put any pathology and then you put shoulder pain issues. You put a search term, you know X-ray, electrical surgery, for all those evidence. What are the evidence, what level of evidence recommends, with the cross references. It's a beautiful site. For any kind of evidence-based practice. pdjournal.org is for the APA, the American Physical Therapy Association journal. Full text is available online. Medscape is for the medical journals. You can get. So search was also done in all these. And in Medscape, you mostly find this biotechnology journals like photomedicine, laser surgery, okay, those journals. Okay. Some will be full text. Most common, we never miss using this site. Okay, that's the most important. Whether we use Google or not, we use Google. Okay. So, any questions? So what was found was, because it influences the cell metabolism and tissue healing at the DNA level, in this neuropathies, which is mostly axonal, one cause can be there, or demyelinating. In both the situations, myelin is from the branches, axonal is part of the neuron cell. So cell regeneration it influences. And the other one is circulatory effect and microcirculatory effects are that of the laser. So that also produces improved circulation and the growth of the nerve, the regeneration of the nerve. It was given at the area which was identified by diagnosis. Okay, proper diagnosis, diagnostic ultrasound. You find out which level the nerve is damaged. It is treated like a deep wound, which is a concealed wound. It's a good question actually. It's nice. Okay, because we cannot give it in the painful spot. Don't give the laser to the painful spot thinking that it's an analgesic modality. It's a tissue healing modality. Okay.
laser on the healing? Does it cause tissue destruction before healing process?
Before healing process, tissue destruction.
Will the healing process start the tissue destruction when you are applying laser?
No, never. Tissue destruction will never come with the low intensity level laser therapy. Okay, never. Even if you overexpose also, what will happen is only there will be a little adverse reaction of increased burning sensation. Thermal sensation is a mild thermal sensation if you apply it for longer. That means if 1 minute it has to be applied and you apply for 6-7 minutes, then it might come. Otherwise, never it was been reported. Adverse reactions were never reported in any of the studies which were reviewed. Which one? No, Arnschulz law is applicable for laser therapy. In that, the first part of the Arnschulz law, where the stimulatory effect is there the low level laser therapy will come. Okay, after that, the destructive effect comes to the other type of therapeutic lasers, which is more of destructive and that is also for surgical purpose. One more question.
Any differences there between gridding and casting?
Yeah, definitely. Because gridding, you saw that we cover spot by spot. We have a mental image of the grid and then we cover spot by spot and we literally don't miss anything. Scanning one, what we do is actually the head is moved. You keep it and you keep moving. We keep it moving and it is actually much slower than what you do with the ultrasound. We might have 10 to 20 seconds, but the grid will be longer duration at each spot. At each spot what you select, longer duration, like 30 seconds will be applied in the grid. But here what we'll do is 20 seconds, 20, 20, 20, 50 keeping moving on. It will be shorter duration per spot. Okay. When you use for the scanning. And none of the studies actually compare between the different types of the technique of application. Okay, in the review, they have not compared between banding, even one technique was the banding technique. Okay, we go oscillating like right and left. Another one is the scanning one, which is zigzag like a snake. Okay, we just keep doing it. And the other one is the grid one, which we keep at all the sides. No one compares different methods of the technique in terms of wound healing. There is a lot of scope. Even comparison was not done between a helium neon laser versus a gallium or aluminum arsenide laser. Okay, because we believe that none of the department will have both. Okay, they keep upgrading and they get one and they leave the other one. Okay. These are some drawbacks. As Dr. Senthil was also telling in the morning, all these subjects, all these studies were all from not on Indian population. It's a huge data which lacks, in spite of the fact that all of us have lasers and all of us are highly fascinated about knowing about lasers. But when it comes to a study and when it comes to physics, we always think we are not in engineering, so we leave the lasers. Okay. But remember, in our practice, when we are used for patients which are unresponding to any kind of therapy. Some patients, it was post-fracture severe fibula, he was with an implant and post-op for around 6 weeks or something. And he was walking, his only complaint was on loading his foot in stair climbing, he gets pain in the anterolateral portion of the ankle. Okay, it's not an anterolateral ligament. It is more towards like a synovium or a capsule which is getting impinged. Okay, when he is loading and going up in the stairs. Okay, could not do anything. He gave ultrasound, nothing happened. Okay, no relief lesion. Again, when I put weight, it is happening like this. Okay, and then one fine day, when we gave the laser, because the manual said, it always specifies. Remember that rely on the manual as far as they are standardized. Manual specifically tells for acute musculoskeletal problems, chronic musculoskeletal problems, what is dosage and which one we can use. Okay. So we refer to the manual and we applied, and the patient had deterioration of symptoms, and then he was telling that when I keep checking for the pain, that time I